of this station, its staff, management, or sponsors.
Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teal. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teal, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone. Welcome to Caregiver Solutions Info Show. This is a hard time we're all going through with the coronavirus, COVID-19. And so in the good of everyone, we're all social distancing, including bringing this show to you via my home, remotely. We want to keep you informed, and we want to keep you connected, and we want to keep everything as normal as possible for as long as we can. So thank you for joining me today, whether you're listening on the iHeartRadio app under WNN, whether you're joining us on your smartphone or your computer on the website, which is caregiversolutions.info. Appreciate you being here. This is a tough time for all of us, and so we're going to get through it. We have a guest today who's going to be talking to all of us about this effect that the virus is having on us from a social isolating point, from things that it does to our immune system, to our brain, the different symptoms that it causes us. It is going to be harder and harder as we go along, and anything that we can do to learn how to make it better is better. So this is something that we all need to take very seriously, and I am so grateful to have as my guest today a doctor who actually spent some of his time this morning at the hospital, and he is also social distancing for both of our sakes. I'm going to be introducing to you now Dr. Heim. He is a neurosurgeon. He's the founder and CEO of Spire Palm Beach, which is a neuroscience center for wellness and recovery in West Palm Beach. He is past national chair of the Young Physicians Representative Section of the Council of State Neurosurgical Societies, and his other interests include medical device innovation and medical advocacy and legislation. He's an international speaker and an author, and he has appeared on the television show, The Today Show, and has also appeared on the Discovery Channel. So joining me from his home office is Dr. Heim. Hi, are you there?
Yes, I'm here. Can you hear me okay?
I can hear you, and I can see you. We have you up on our webcam there, and you're looking good. And I just have to say, first of all, thank you so much for taking the time to join the show today. I know you're on call with the hospitals. I know you're very busy. This is a really crazy time, and I can't thank you enough for joining the show today.
Marcia, thank you so much for the introduction. I would say, I would love to have been there. I think the social distancing is the safest thing to do. at this time, given the current infective rates that we have seen of the COVID-19. I think we have to be careful. So, I think social distancing at this point is a very good idea.
Well, social distancing is one thing, but let's talk a little bit more about some of the things that you are actually very affectionate about and have been touting all along, especially with Inspire, is the mental health. And so with this COVID-19, with the social distancing, with the precautions we all have to take, with the self-isolating that some of us have to go through, what is this doing to our mental capacity, and is it short-term or will it have long-term effects?
So I would like to first introduce a little bit more for our guests. What is this coronavirus that's going around and everyone is talking about? So this coronavirus, or COVID-19, it's from a large family of viruses. This is a well-known family of viruses. What is different in this particular scenario is that this virus originated in Wuhan, China, and we know it infected animals, and it transmitted from animals towards humans. So that's where we need to really take that step of being careful with the social distancing, and we know that the infection rates are currently very high here in the United States, and we just have to be very cautious.
Well, I know right now my latest figures I received, we're both in Palm Beach County, Florida, and we just hit the 500 mark of people that are confirmed positive with the coronavirus, and every day it keeps growing. So, everybody's staying home, everybody's trying to stay busy, but I'm sure that it's causing many people some anxiety, and isolating and being away from people and social distancing. How does that affect us? Has a toll on us, and your forte is the brain, and your forte is staying healthy and well. What do you see that long-term and even short-term that this is doing to us as a people?
So what I have seen is that this social distance, we are all very social beings. And being social beings is important for our ability to carry on day-to-day activities with interaction. And I would venture to say, how can we continue our socializing with other human beings during this time? And that's what's most difficult. With what we have right now is being able to stay away from infecting other people and allowing this virus to transition within a single organism and not infecting other people.
What about people that just can't handle that being isolated, causing them anxiety and worry and fear? I mean, how does that must be breaking down a lot of defenses that we may have to protect ourselves, don't you think?
It definitely does. I would say that as it relates to the viral infectivity or infection rate that we currently have, it is on the lower side, but it is easily transmitted from one person to the next person or spread very easily. And that's where we really need to be careful, because we have seen that this virus can spread very easily, and especially in the hospital, I'm always very, very cautious with being able to protect myself and protect others. And I feel that, that was one reason why I made the decision this morning. Let me stay away, stay distancing myself from being on the show. I would love to have been on the show, but I think it's better to distance myself and not be on the show. I had a very good friend, James Goodrich, Dr. James Goodrich. He just passed away yesterday from coronavirus infection in Montefiore Hospital in New York. And,
I'm so sorry.
Yeah, it's very sad. And he was slated to win the Cushing Award in likely 1 or 2 years. So it's very sad, what has happened and what is happening. I am relatively protected as a neurosurgeon. I have seen a lot of ENT doctors or ears, nose, and throat doctors, otolaryngologists. They are more prone to getting this virus, but taking the proper precautions, they should be safe. So one has to always make sure that you adhere to strict guidelines when caring for patients.
Absolutely, absolutely, and all of us doing what we can. We're going to take a quick break. We'll be back in just a moment with Dr. Colin and more about what this coronavirus is doing and what we can do to keep ourselves at least a little bit happy and healthier. So stay with us. We'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
Welcome back to Caregiver Solutions Info Show. I'm Marcia Teal, and my guest today is Dr. Heim. He's a neurosurgeon in West Palm Beach, Florida, Palm Beach County, putting his life at risk, helping others in the hospital. And again, thank you, Dr. Colin, for being here, talking about this coronavirus. And we established that definitely people are anxious, people are fearful, not only with fear of their health, but also, let's not forget what has happened recently in the stock market and the downturn in the stock market, causing people to have sometimes more fear, more uncertainty. So the combination is just really unprecedented as we go through these days and months ahead. So I want to talk a little bit about what people can do, things that they can do while they're self-isolating, while they're social distancing, what they can do to reduce the effects of the fear and the anxiety and maybe even depression. And speaking of depression, it's got to get to people. And I know you deal in your company a lot with depression, and some people don't even know that they're depressed. So let's talk a little bit first about the signs and symptoms maybe of depression, because I think a lot of people, wouldn't even realize that they're suffering from that all the time. What's your take on that?
So one has to be very cognizant of some of the depressive attitudes displayed in individuals. The problem is that the individual, him or herself, it is quite difficult for them to realize that they have depression. A lot of times it's going to be masked, and it's only an astute clinician that can reach that type of diagnosis. Someone that's isolating themselves, there is apathy in what they're doing. They don't have what you would call the normal zest in life. When people develop that normal zest in life, that's where we can say, okay, that person likely is not going to be depressed. However, when we see people that are apathetic towards certain behaviors, that are becoming forgetful, that are isolating themselves more and more and more, typically those are people that are in danger for being severely depressed, and one has to be very cognizant in these cases to be able to lift up that person from where they are in that depressed state and bring them back to a more confident place in life.
So if we're home and we have a family member living with us and we're trying to social distance, and we see that maybe somebody is just so worried and they're not themselves and they're self-isolating as far as being apathetic and things like that, is there something that we as family members can do to help them, or is this something that they have to actually go see a professional about and take medication? Where do you draw the line?
So I'm very clear on, I'm not a fan of too much medication at all. True, there are instances where medication is required and is necessary to improve the clinical state of an individual. However, I would not recommend it right off the bat. So someone walking into the office, you can typically assess the person and attempt to treat that individual before you do medications. You should do some of the other opportunities that we have, or those clinical therapies, such as shaman therapy, such as meditation, mindfulness. Meditation is a very important tool that can be used to relieve that depressed state, where we have enriched positivity in our lives and allow the person to come out of their clinical state of depression without medication. It doesn't work for everyone. That's very true. It doesn't work for everyone. However,
so
the
meditation,
Mm-hmm.
the meditation would also be good for anxiety as well as depression and overall maybe peace of mind. But there are a lot of other things. So some people just say, well, I can't get into that. I just can't do that. I know that you have listed on your website several ways that people can reduce anxiety, reduce their nervousness, their fearfulness. And one of the biggest ones I think is awesome is working with your hands. Why does working with your hands help to reduce anxiety?
I love that. That's a great question. I am a fan of that instant gratification. I use my hands. I love using my hands. I would say I talk with my hands. instant gratification that we attain after we're able to achieve a beautiful work with our hands is fulfilling. It's fulfilling for many. And if as an example, if we do a beautiful painting, we sit back and we admire our own painting. And that generates a sense of fulfillment within the individual. Importantly, is to understand not only mindfulness of what we just achieved, but rather purpose. And being able to deliver purpose, why we are existent in this world, and how we can alleviate the pain and suffering of others, that could be purpose, and that can be our purpose. However, purpose also goes for people that might be taking out the garbage. That should fulfill a purpose in life. And it's just as important as when I do brain surgery on someone. Without having that purpose in life, without having that zest for what we do that achieves the exuberance within the individual, we can fall into depression. We can easily fall into a depressed state. True, there are ways to stimulate our brain, and through brain mapping techniques, we can, as an example, we can use a deep TMS machine that will help to stimulate areas of the brain which might be what's called hypoactive, not so active. So when you stimulate those areas of the brain which are causing increased anxiety, you can actually wind up relaxing the brain more and more.
Wow.
And that's very... Go ahead.
Yeah, what you said is so true. Even when you're doing something that some people may think is not significant, as long as you're getting the satisfaction from it. And, it doesn't have to be brain surgery, like you said, although I'm glad that that is your forte, and not others that don't have a passion for it. But doing something, and I can attest to that because, you mentioned painting. Well, a lot of people say, well, I can't paint, but there are so many things that people can do with their hands. And I'll give you an example. The last few weeks being home, I have done so many simple things to keep myself busy using my hands, and I have felt so accomplished. And I can tell you, one of them was, baking and, doing a new recipe and measuring and cooking and stirring and using your hands that way, and then you have the result. And then another one was cleaning the rugs and using, the cleaner and mopping the rug and vacuuming it all up and seeing how nice it was afterwards and being so happy that it looked good and feeling accomplished, and, going outside and working in the yard. I mean, you can social distance and still be outside, and, raking up the leaves and mowing the grass and planting flowers. I mean, these are all things using your hands, and they do, like you say, give you that sense of accomplishment. And so I hope that listeners are paying attention and using their hands. They might not be able to use, so much of their brain that's wired for their work if they're not able to go to work, but find ways to use your hands, and I think you'll feel better. And thank you for that. I love that.
And I think that brings us to a simple question. Are we allowed to go out to the park? So while true, we have to be careful with distancing ourselves. You want to make sure you keep that safe distance, and it's medically discussed as 6 feet. So you should not come within 6 feet of another individual. I would say that it's okay to go outside. Even just hanging out at the park, going for a jog or a walk, getting fresh air, that's vital. I take all my I talk to the ICU all the time, and I tell them it's important to take people outside into the fresh air and into the sunshine, and allowing them to breathe the fresh air, see the sun, and recover. A lot of times, staying inside a dark and gloomy place that's, with like the ICU is, beep, 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 beep. It'll drive you crazy, and it's not healthy. And you want to be able to go outside, and I think the sun has healing powers. I'm not saying we should worship the sun, God forbid, but I'm saying we should definitely appreciate that warmth from the sun and the healing that it achieves in different individuals.
And especially not only patients in the hospital that are confined to the bed and getting them in a wheelchair and getting them outside, but a lot of caregivers, a lot of spouses are home with the person that they're caring for that may have some form of dementia, and that is really tough because they can't go to the normal places that they've gone before to get respite. So taking your loved one that has dementia, outside, walking around the yard, getting them that fresh air and sunshine, is going to be very valuable to their state of mind also.
Just making sure you maintain that 6-foot distance. I would say, you should be very safe to go outside, and I guess that brings the question: should you wear a mask outside if you step outside? A lot of medical experts have discussed this. Is it necessary to wear a respirator or a mask when you go outside? Not necessary. Not necessary at all. If you are dealing with a sick patient, that's when you should wear a respirator or cover your mouth. Make sure you have a mask on. Make sure they have a mask on. Remember, how is this transmitted? It's easily transmitted through droplets, through nasal droplets, which can form and carry the virus, and that's what you have to be wary of. Right? So
Absolutely. Absolutely.
We don't need to go run and hoard, N95 masks. I think the N95 masks, we should save them for medical personnel that are working with patients which have suspected infection. Not just anyone.
Right.
However, there is, it's well known, there's what's called asymptomatic transmission of the virus. So, in other words, the person might not look infected, but yes, they are infected. So that's where we have to be careful as well,
Well, if someone had a mask, and I don't, if it's not a surgical type of mask, and they wanted to go outside or they needed to go to the grocery store and they wanted to just take extra precautions, could they not put a handkerchief over their nose and mouth? Would that do any good at all?
Yeah, it does. It does. They even a scarf, even a scarf, covering up with a scarf, it will help. Talking about masks, and I really don't want to get into the nitty-gritty. I don't think there's a purpose on the show, but there are a variety of levels of masks. There are level 1, level 2, level 3, and like an N95 mask. So level 1 is the lowest. It has the most openings in the mask itself. It's the least pricey, least expensive mask. Again, that's a level 1. Then you have a level 2 and a level 3. I don't have any of these masks in front of me, but I could have shown you what's the difference between one and the other and the other. And an N95 mask is a more protective. It's the most protective mask.
Okay, so thank you for explaining that, because a lot of people, worry or wonder about that. But I guess the bottom line is, if you want to take extra precaution, put a scarf, put a handkerchief. If you're going somewhere, wash your hands. Yeah,
wash your hands, and social distancing is the best way to protect yourself and protect others.
Absolutely. Well, thank you. We're going to take a break, listen to our corporate sponsor, but we'll be back in just a minute or two. So stay with us. We have more questions about this coronavirus and what you can do to stay healthier mentally and physically. We'll be right back. Stay with us.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help, because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'd like to take this opportunity to thank our national sponsor of the program, Arden Courts Memory Care Communities. Arden Courts is a leader when it comes to memory care. They have about 50 memory care assisted livings throughout the United States, and 10 of them being here in Florida. By the way, they're taking all precautions during this time of coronavirus to keep not only the residents safe, but the families safe. But they want to connect with you, the family caregiver. If you're watching this show, they'd like to offer you a resource so that you can learn more about caregiving and about dementia in general. And this is called the 36-Hour Day Book. It's a wonderful book written by Dr. Peter Rabins and Nancy Mace, and it can be yours just for the asking. All you have to do is call the toll-free number, tell them that you heard about the offer on the Caregiver Solutions Info Show, and they will be happy to get your name and address and make sure that a book gets mailed directly to you. So that number to call is 888-478-2410. Again, 888-478-2410. Give them a call today. Get your free 36-Hour Day Book. It would be a really good thing to have a chance to read it while you're being social distancing and isolating at home, and catch up on reading and have something new to read. So Art and Quartz would love to mail this book to you, so just give them a call. This day we are talking about the coronavirus, and my special guest is Dr. Heim. He's a neurosurgeon in West Palm Beach, Florida, and he's graciously joining us today from his home office. And we're talking about the coronavirus, how it affects our psyche, our being, our whole being, giving us sometimes anxiety and depression. And we're talking about ways that we can counterbalance that. And Dr. Colin, I appreciate you so much, and all that you're doing and helping there at the hospital. I know that you had a case this morning. We're social distancing and doing the show virtually here today. But your company, Spire of Palm Beach, which we mentioned at the top of the show, the word inspire. Now, that in itself inspires me to think of the word inspire, and I think that's something to talk about on this program today when we're talking about how to, have less anxiety and depression, and what we can do ourselves to inspire us, inspire others. And there are ways to inspire during this COVID-19 crisis that, let's throw out a few of those things that we can help people, little things that maybe someone hasn't thought about. And the first one that we actually talked about earlier in the show was the daily meditation. And we talked about how important that is. But for people that maybe don't meditate, what are some other things that they can do to inspire themselves or others as we're battling this virus?
So, it's interesting. I'll mention something that my mother mentioned to me this morning, and that was that she said, focus, because I sent a link on where you can look live at the number of coronavirus cases that occur in the United States. And, we have a chat between all of us, between myself, my brother, my sisters. And so her comment back was, Chaim, you should be focusing on healing, not on the infection rate. And I sat back and I thought to myself, that is very true. It's focusing on the negative. And we should focus always on the positive at all times in our life, especially so during a time like this. So it should not be, let me focus on how many infections have occurred in my hospital, how many people are infected in West Palm Beach, how many people are infected in Boca. That's the wrong attitude. Our attitude should be how many people don't have the virus. And it's a huge number. I thank God, that I'm healthy. My wife is healthy. People that work with me at Inspire are healthy. So I really appreciate that. I think it's important to count our blessings, right? So in that lends to greater gratitude in life.
Absolutely. The gratitude is something we can all focus on. Not
and it
watching
decreases anxiety. It decreases your anxiety.
Yeah.
If we focus on the negativity, we're going to increase our anxiety.
So be grateful and appreciative.
Be grateful.
And don't
Always
watch
be
the
grateful.
news so much.
I'm sorry?
What about, you also mentioned on your site with Inspire, again, watch what you watch, meaning don't focus on the negative, watching all the news reports. I know a lot of people are watching movies about viruses, and, it's just going to cause more fear. But one of the things that you also mentioned was learn something new. Use this time wisely, right? Learn something new. I think as a proponent of brain health, one of the things they always say is to exercise your brain, right? So what better time to do it than now when you have the time?
There is something that's called the Nun Study, and the Nun Study looked at patients that developed dementia over a period of 30 years. This was observed, and again, this is an older study. It was over 20, 30 years ago when it was first started. I'm sure you can just Google the Nun Study. And they took a group of nuns and they studied these nuns. And why nuns? Well, not because they're Catholic, but rather because they eat the same, they dress the same. So it was a perfect way to study people. So you had a lot of variables controlled. And in this study, they found that people that were social, people that drank coffee, they were protected more against Alzheimer's disease than other individuals. So nuns that would go out there and garden by themselves, that were more loners, that were more on alone time, those were people that were at greater risk for developing dementia. So I would say it's important to stay social, whether it is social distancing, but here we're being social. We are still interacting on a video camera. True, you're not here, I'm not there, but we're still interactive. And when we have the opportunity to interact, we are social beings. It's very important for us as social beings to interact with people that surround us as much as possible. So true, in this particular case, yes, I'm not there present physically, but I'm here on a video. And, I think that it offers the opportunity for some type of social interaction. I don't understand all the social interactions that can occur via FaceTime or video chat or anything like this. I'm sure it's been more widely studied at this point. But it's important to keep our minds active. Stay active at all times in your life. I would say I've had a lot of questions with regards to vaccinations. There are people that have asked me countless times, especially in the hospital, do we have a vaccine? Do we have a vaccine that I can take? We don't yet. And there was a study that was launched in mid-March, but that's not going to be done for the next 6 to 8 weeks. So we need to take care during this time, however, to continue to wash, continue to stay clean, avoid touching our faces. I know I touch my face all the time. I touch my chin. That's normal. But we have to be very careful. The other question that I have had is, well, what do we do if my family member gets sick? I I would say we should, well, one, take them to the doctor to be assessed. We don't know if he or she might need to be tested. I think it might, the doctor can assess the patient and see if it warrants a test or not. We should make sure that you're protected and they are protected. So in other words, they should have a mask on their face. You should have a mask on your face while you're caring for them. You should try to, if you have the opportunity to have a separate room, have a separate bathroom, that will be the time that you want to socially really isolate. Not that you have to say goodbye to the person, but rather that there would be that distance between that person and you so that you don't get infected.
Oh, thank you for reminding us all how to stay safe. You're a neurosurgeon, and there are a few other things on your plate right now, and things that are typical in your realm of work that might be something that you may...
Marcia, I just want to tell you, I have
What's
spoken the majority of time on degenerative disease of the spine, on spinal fractures. The majority of times I never talk about a virus. When I come on some of these shows, rather I might be talking about brain tumors, I might be talking about spinal fractures, degenerative spine, spinal stenosis, more of that surgical realm than talking about a virus. So it's interesting.
Yeah, I mean, times are changing, right? But
yes.
You do mention one thing that may be of interest to some of our listeners, was the brain tumor, because sometimes there are tumors in the brain that can be in the wrong place, that can be causing dementia. Sometimes there's the water on the brain that can cause dementia.
Normal pressure hydrocephalus.
Yes, normal pressure hydrocephalus, and those are things that are in your line of work. We have a few minutes left to talk a little bit about that and success rates with those types of things that you've seen, and as far as people with dementia, and if that's the cause, what are our outcomes? Is it an option for most people? What's been your experience with those types of brain issues?
So before I segue into this, and I will, I think it's important for everyone to understand, well, what can we do for preventative measures with viral type infections? So getting IV therapies, getting anxious relieving type therapies, whether it's simply discussion with a clinical psychologist or not. I think these are important points to really take. Taking vitamin C, taking, some of the zinc, multivitamins in general, it's going to help a lot with some of the preventions that we discussed with viral infection, Very
Absolutely.
important.
Anything we can do to try to stay healthy is important. We only have a few minutes left, and just in case we don't get to it, I want to let everybody know that you have a company, the founder, Spire of Palm Beach, where you help people, and you help people with all kinds of issues with the brain, with addictions, in recovery, and your focus is really on helping people to get better. And if someone is interested in contacting your office, can they do that? Are you taking calls, or how should they do that?
Yes, we are. I don't have, hold on, I can look actually for the number. My apologies, I should have that number. Okay, so the Inspire Palm Beach number is 561-377-8772. Again, 561-377-8772. And you can ask for myself, ask for one of our clinicians, and we're happy to help however we can.
And you also have a website, inspirepalmbeach.com.
Yes, inspirepalmbeach.com.
So you want to check that out. Okay, it's inspirepalmbeach.com. Check that out, and Dr. Colin and his associates are there to help you. So we have just a few minutes. If you want to touch on some of the brain surgery types of things that you do real quick, I'd love to hear about that.
Sure. So something that was mentioned earlier is the normal pressure hydrocephalus. That's where you develop, or the patients develop, increased water in the brain, but it's under normal pressure. That's why it's called NPH, or normal pressure hydrocephalus. There is a classic triad that is seen in the majority of these patients. They develop, so I always joke and I always say wet, wacky, and wobbly. And why wet? So
the water.
Because the water. And what happens? They pee on themselves. So they dribble urine on themselves. That's one, right? Wacky. So they can become demented, slightly demented. And when you see that there is an onset of this type of dementia in association with some of the clinical picture as it relates to having urinary difficulties with being able to control your urine, wacky, that you're slightly demented, and wobbly, that your ambulation, your ability to walk well, is altered. And these patients will have difficulty with walking, and not only with walking, but more so with balance. And when not treated, and this can be treated very, very successfully, very easily. Obviously, you need to make sure, typically you get a lumbar puncture, and then, so lumbar puncture meaning take some fluid out of your back. They're seen by a physical therapist, assess if there's improvement in their gait. If that improves, typically they're going to improve with a shunt. So
yes, and I actually had a resident that had that operation with a shunt and did very, very well going forward with that.
Yeah.
Yeah, very successful. Well, I admire what you do, and I hope you stay safe out there.
Thank you. And I just want to discuss, I always discuss with patients, it's important to understand what are the risks of even having this type of surgery, the shunt surgery. So the greatest risk is always having an infection, so one has to be very careful.
I would imagine there's risk of infection with most surgeries, right? And and speaking of infections, and here we go back to coronavirus that we're dealing with. But thank you again. I appreciate you. I hope to meet you in person someday when we don't have to social distance.
Thank you. Yep, I look forward to meeting you.
Thank you. And to all of you, stay safe. Give yourself a hug. We usually say give someone else a hug on the show, but now just give yourself a hug. It'll feel good, and you'll feel better for it. So we'll see you next week, same time, same place. Take care.
Thank you.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.